Hi, welcome. My name is Kate Borsato. I'm a mental health counselor and I work entirely with pregnant women and postpartum moms, and I'm all about supporting you to transition into motherhood in the best way you can so that you feel ease and joy and don't lose yourself along the way. So thank you for being here. Today we're talking about postpartum depression. So I want to walk you through exactly what that means, what signs and symptoms to look for, and how you know if maybe you need a little bit more support. So again, if you're new here, I would love for you to introduce yourself, say where you're from, and let me know what you're needing help with. So I really like to create videos that are most relevant and most meaningful and useful to you, but I need to know what you need. So let me know in the comments what you're needing help with, and I would love to create something to support you. Subscribe to the channel as well, and make sure you click the bell so that you get notifications every Wednesday when I put up a new video. All right, let's jump into today's video. Now, you're probably here because you're a new mom or you have a baby at home and you're struggling, right? You might be having a hard time right now and feeling a bit concerned about what's going on, where you're at, how your mood is. And so I just want to first of all say good for you for reaching out, for searching, for looking for some support. That is a huge sign that you are gaining momentum and that you are going to be okay. You're going to get through this. You've already reached out. You've already done like some of the hard work. Okay. So please give yourself some credit. I also want you to know that no matter how hard this stage is for you, you will get through this with support. Okay. We know that all symptoms of postpartum anxiety and depression are treatable, but sometimes you need support to do that. Okay. We don't need to get through this on our own. So please reach out if you're struggling, if you need some help. I'm going to link to some resources in the description of this video so that you have some places to start. But I just wanted to say again, good for you for being here, for reaching out, and for getting support. Okay. I also want you to know that struggling during this postpartum year, I like to think of it as the whole year really, it's so common. I don't know if you know this, but 1 in 5 women, at least 1 in 5 women, struggle with postpartum anxiety and depression. That's huge, right? Think of the women that you know, the mothers that you know. So many of them have had a hard time. So I share that not because it's okay that you're struggling, but just so that you know that this isn't your fault and it doesn't make you bad or not good at this or wrong in any way. Motherhood is really hard to adjust to, and if you're struggling, it makes sense. This is like one of the biggest, hardest transitions you will ever go through. Okay, so you are not alone, and you will get through this. Now, the first thing I want to talk about is the difference between baby blues and depression. So sometimes a mother's experience will get minimized or sort of pushed aside as if it's just normal, right? Oh yeah, that's a normal thing to go through. Postpartum depression isn't something that you just have to deal with because it's normal. No, you need support. Baby blues is that emotional dip that happens to almost all mothers, and it happens around like 5 days, 10 days postpartum, and it's like your hormones drop, you're adjusting, you're sleep deprived. It's very normal to take a bit of a hit with your mood. So you might be feeling really weepy, reactive, down, sad, just struggling with your mood. So when that happens around 5 to 10 days postpartum, that's probably baby blues. But usually moms will recover from that pretty quickly within a few days. So if you're finding right now that you didn't bounce back from that, or that this sense of like being down and low and struggling is prolonged, that's a lot different. And so that indicates, when it's prolonged, it indicates that maybe this is depression or something else, okay? So baby blues, again, you kind of dip in and then you come out within a few days. Postpartum depression would be more prolonged challenges. Okay, so the other thing I want to mention is that postpartum depression or anxiety can start within the whole first year postpartum. So often we think that it's like 6 weeks and then you're clear, or the first few months and then it's not a thing anymore. But some women don't feel symptoms, and then like 6, 7, 8 months in, then they start to have challenges with their mood. So really, postpartum depression is, we use the term postpartum because it's talking about the onset. So the onset has to be within that first year postpartum. But there could be a mom who has a 3-year-old child and she still might have postpartum depression because it began during that first year and maybe it went untreated. So it's still postpartum depression. So really the only difference between postpartum and regular depression is the onset happens during pregnancy or that first postpartum year. So I hope that clarifies anything with that. All right, so I want to talk about the main symptoms of postpartum depression. And as I go through this list, I want you to just think about yourself and your experience and overlay it with what I'm talking about and just see if you can notice if anything feels similar or if you resonate with anything. And that's a good sign that you might want to talk to somebody and get some more support. So the first major sign of postpartum depression is having a really low mood. So when I say that, I mean just feeling really down, sad, weepy, hopeless, helpless, like this is just never going to change. I can't see any way out of this. Some moms feel really trapped. And the key here is that it's prolonged. So you might have like a dip where you feel that in a day, but with depression, it's longer. So weeks at a time where you feel this really low mood. So that's a really important sign to notice. Another sign that can come up with that is really just feeling a sense of despair and complete overwhelm. So that's a little bit different than just feeling down and sad. When you feel overwhelmed, it feels like you can't manage anything, like any small little thing just sets you over the top. Maybe you feel like you can't manage anything else. Like if there was one more thing put on you, you would just break. That sense of despair, that can sometimes indicate depression, okay? So again, just notice if you're resonating, if this feels familiar, if you're having emotions come up. I want you to listen to those, take those in as maybe a sign that you deserve some help here, you deserve some support. I also want you to notice sleep disturbances. Now, I remember when I was learning about all of this in depth, thinking, well, how could a sleep disturbance be a sign of postpartum depression? We're all disturbed with our sleep with a new baby. Of course you are. But when we think about sleep disturbances as a symptom, it has to be above and beyond the normal disruptions of sleep from your baby. So of course your baby's going to wake you up to nurse and to be changed and comforted, things like that. But sometimes moms find that they actually can't fall back asleep very well. So sometimes you might even feel insomnia or you don't want to sleep. So maybe baby is sleeping and you just don't even want to go to bed. You just want to sit up. But you know that you need to actually rest. So it's, when I say sleep disturbances, it's above and beyond what's normal, what's expected from your baby, okay? Another sign or a symptom would be a loss of enjoyment in things that normally would have brought you joy, all right? So maybe there's things like seeing friends or gardening or cooking, things like that you maybe really loved and now they're not bringing you joy anymore. That's a symptom or a sign that you might be experiencing depression, okay? A couple more that I want to talk to you about. One is the inability to manage day-to-day tasks. So this might be similar to that sense of overwhelm or despair, but possibly simple things like, you know, unloading the dishwasher or having a shower or things that are normally pretty reasonable, you're able to do. You might find that you're having a hard time doing those things. So that is also a sign that you could be experiencing depression. And then another incredibly important one that I really want to talk about is having thoughts of suicide, self-harm, or harming others, okay? So I know that might be hard to hear, especially if you are feeling these things, but this is so important to talk about because many people feel this, all right? So if that's the case, if you're feeling like my baby would be better off without me, I shouldn't even be here, everybody would be better if I was gone. If you're having those kinds of thoughts, it's absolutely crucial that you reach out Okay, and again, I'm going to link some contacts below, but I want you to know very loud and clear that your baby is not better off without you, that you are the perfect mom for your child, right? No matter what you're going through, you are the perfect mom, and your baby needs you, and you are good enough, and you will get through this. Okay, so just noticing again, this may or may not resonate with you, but if it does, you are allowed to tell somebody. There are people out there to support you, and you deserve support, right? So those are the main signs of postpartum depression. Again, this might start anywhere within that first year after having a baby. The key here is that it's prolonged, that it's at least a few weeks. That indicates that it's more than just a dip in your mood or having a hard day. It's like it's something that's prolonged and it's not getting better. So what do you do about it? What are your options? Well, again, I'm going to link to some resources. The most important thing that you can do is tell people, is get help. So often we feel shame when we struggle. We feel like we should be doing better. We shouldn't be having a hard time. But then we just stay silent and we keep ourselves hidden, and we don't get support when we do that. And you deserve support. You are not alone in this. So many women feel this way. And we know that when you get support, you do heal and you get through it. So that's the most important thing, is that you talk to people. You tell your partner, if you have a partner, tell your family, reach out to a therapist, right? Reach out to the Postpartum Support International, which I'm going to link to. There's a lot of resources out there for you. So make sure you're letting people in so that you can be supported. It's the most important thing. I'm going to include a workbook that I have. It's a postpartum mental health workbook that can help you get started and supporting yourself. I'll link to my website as well. There's lots more information there. And make sure you browse through the videos on my YouTube channel. There might be some other resources that are helpful for you. But above all, reach out for support, because you deserve it and you can get through this. So thank you for being here. I'd love you to subscribe to the channel and get the notifications of when I post some new resources. And again, let me know what you need help with. I'm really happy to create some things that are useful for you. Take good care, and I'll talk to you soon.